Good morning, and thank you for joining us this morning. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, Peel's Medical Officer of Health, Nancy McDonald-Duncan, our Assistant Fire Chief, and Sam Rogers, our Director of Enforcement. I want to start off by wishing Mississauga's South Asian community a very happy Diwali and Bandi Chor Divas. This is a special time of year when families and friends gather to celebrate the virtues of tolerance and inclusivity and the promise of living a good and rewarding life. And I'm so happy that this year we are once again able to come together to celebrate. And as you light a diya this Diwali, I wish you endless joy, prosperity, health, and wealth to you and your families. And of course, please celebrate responsibly. Shubh Diwali, everyone. I also want to quickly again thank Bombardier for the $510 million investment the company has made to build their global manufacturing center at Pearson Airport here in Mississauga. Mississauga's aerospace sector is the largest in Canada, with over 345 diverse, world-class manufacturers, many of whom are in Bombardier's supply chain. This new manufacturing center will play a critical role in strengthening our aviation sector, giving many Mississauga-based companies the opportunity to continue supporting Bombardier with leading-edge capabilities for their global series of business jets. It will bring 2,000 jobs to our city, and likely many more in the coming years. Bombardier's presence in our city will undoubtedly help in our economic recovery. And I look forward to working with Bombardier and Pearson to find new ways to bring more aerospace investment to Mississauga. And now for my COVID-19 update. We continue to make huge strides in our battle against this virus. And I'm very relieved that we saw a significant decrease in case counts over the last week, with Mississauga now averaging 16 cases per 100,000, and that's down from 24 last week. Peel region as a whole is averaging 15 cases per 100,000, and that's down from 20 last week. This is great news, especially as we've seen the loosening of public health restrictions over the last few weeks. What's also very encouraging is that more than 84% of our residents, 12 plus, in the region of Peel have now had 2 doses of the vaccine. That's close to 1.2 million people in Peel who are fully vaccinated. We also heard from Ontario's Chief Medical Officer of Health yesterday about the plan to open up booster shots to more of our residents. Starting this Saturday, residents 70 years of age and over, those who received 2 doses of AstraZeneca or 1 dose of the Janssen J&J vaccine, as well as frontline healthcare workers, will be able to book their booster shot. First Nation, Inuit, Métis adults, and their non-Indigenous household members will also be able to book. The booster shots will either be Pfizer or the Moderna vaccine, but it is important to note that these groups are only eligible for a booster shot if it's been 6 months since they received their 2nd dose. Eligible residents can book starting at 8 a.m. this Saturday through the provincial online booking system. While hospital-based healthcare workers are encouraged to reach out to their employers to get vaccinated directly through their hospital's vaccination program. The province expects to open up the vaccine to more age cohorts in the coming months. This is great news, and I thank the Ontario government for taking this very important step to protect residents and the larger community. I do also want to note that a booster shot is not mandatory, and if you choose to not get a booster, you are still considered fully vaccinated with 2 doses. Your vaccine certificate, for example, will still be valid. At the same time, these booster shots will provide protection to higher risk groups who may be seeing a gradual waning of immunity since they were among the first to receive their vaccine. Needless to say, I encourage all eligible residents to register for their booster shots this Saturday. I also know that there's a lot of questions right now about when the vaccine will be approved for 5 to 11-year-olds. Pfizer has submitted an application to Health Canada, and we are now waiting for it to be approved, as well as for the guidelines from the National Advisory Committee on Immunization, or NACI, as it's known. I want Mississauga residents to know that we are ready to get going on this as soon as Health Canada gives us the go-ahead. To accommodate vaccines for 5 to 11-year-olds, as well as booster shots, Peel Public Health has once again significantly ramped up capacity to deliver more doses of the vaccine. Through the fall and into the winter, residents will have hundreds of locations to get their vaccination that they need. Vaccinations will be delivered through large public health clinics in Mississauga, mobile clinics and vax vans in accessible and convenient locations, such as malls and parks, weather permitting, of course, community clinics at schools and places of worship, co-designed with our community partners, and of course, primary care and pharmacy clinics, and in-home vaccinations for those living in long-term care and retirement homes, and for those who can't leave their homes. I do want to be very clear that while booster shots are coming online and the vaccine is expected to be approved for 5 to 11-year-olds in the coming days, we are still fully committed to reaching our goal of getting 90% of our residents, 12 plus, fully vaccinated. I know I say this every single week and almost every single day on social media, but please, get your first dose if you haven't already, or your second dose if you are eligible. While case counts are in a good place, we still have among the highest number of COVID hospitalizations in the entire province, with Trillium Health Partners currently dealing with 20 COVID inpatients and 2 patients in the ICU. This is significantly higher than Brampton's William Osler, as they only have 6 COVID inpatients and 1 in the ICU. I've spoken with the leadership at Trillium Health Partners, and their modeling predicts that they will continue to see 20 to 30 COVID inpatients at any time during the coming months. And the only way to get this number down will be getting more people vaccinated. When I posted about this on social media, I got some responses asking why this is such a big deal. 20 hospitalizations out of a population of close to 800,000 people. Yes, we're certainly in a much better position than we were in the spring, but these 22 hospitalizations are largely preventable, as the vast majority of these cases are in people who are unvaccinated. These 22 cases put additional strain on our already overburdened hospital system. They take doctors and nurses away from other patients. So this is actually a very big deal. I'm asking everyone to do their part in protecting our hospitals. This week, we have several pop-up and school clinics running across Mississauga. The Wellfort Community Health Clinic is offering the vaccine today from 2 p.m. to 7 p.m. and tomorrow from 11 a.m. to 4 p.m. at Westwood Square Mall. Peel Fairview Clinic is offering the vaccine tomorrow and Friday between 10 a.m. and 2 p.m. And school clinics are also running this week at Father Michael Gates, Father Daniel Zanin, and Our Lady of Mount Carmel. For more information on where to get the vaccine, please visit the Region of Peel's website. I do also want to take a minute to thank the Ontario government for taking some significant steps over the last few weeks to better protect workers in Ontario, including introducing legislation that would give employees the right to disconnect from the office, as well as legislation that would remove barriers faced by many newcomers when they seek employment in Ontario, most notably the requirement for Canadian work experience in their fields. We also learned earlier this week that the minimum wage will increase to $15 an hour starting on January 1st, 2022. I want to personally thank Premier Ford, Labour Minister Monty McNaughton, and Finance Minister Peter Bethlenfalvy, and the entire provincial cabinet for taking these important steps. Many minimum wage earners in Mississauga didn't have the luxury of working from home during the pandemic, with many taking huge personal risk by going into factories and warehouses to ensure that all of us had what we needed to get through the pandemic. A raise in the minimum wage will help tens of thousands of Mississauga residents. I do recognize that there are legitimate concerns that $15 an hour is not nearly enough to live on, especially in the GTA, but this is a step in the right direction. All levels of government and private sector partners must continually strive to put policies in place that provide more for our workers. Before I bring up Dr. Lowe, I also want to give the residents an update on our plans here at the City for New Year's Eve. With capacity limits now lifted on outdoor events, I'm happy to announce that we will be having a New Year's Eve event this year at Celebration Square, open to all community members. There will be a DJ, skating, heated patios, food trucks, and light installations. And yes, a countdown with fireworks. I look forward to sharing more details with you in the coming weeks. Mississauga, we are steadily getting a firm grip on this virus, but please get vaccinated if you haven't already. Book your booster shot if you're eligible, and please continue to wear your mask when you're indoors. And please, if you have any COVID symptoms, get tested and isolate until you get your test results back. And now, I'd like to invite Dr. Lawrence Lowe up to the podium for his update. Thank you.
Thank you very much, Madam Mayor, and good morning. This week, Mississauga's cases of COVID-19 are at 15.9 per 100,000 with a test positivity of 1.5%. Nearly 89% of Peel Region residents have now had one dose of COVID-19 vaccine, and over 84% have received 2 doses. Building on the success of having delivered more than 2.5 million doses across the system with our partners, Peel Public Health released our fall and winter vaccination plan last week. In the coming months, we are expanding offerings at 5 public health fixed mass clinics, 275 healthcare system clinics, including pharmacy and primary care, and over 150 community-based clinics to double our system capacity from 100,000 doses presently per month to nearly 200,000 doses by December. This expansion is particularly relevant with the province recently announcing expanded third dose eligibility for the following groups when at least 6 months have passed since the individual's last dose. This includes individuals aged 70 and over, i.e. born in 1951 or earlier, healthcare workers or designated essential caregivers in congregate settings, including those working in long-term care homes and retirement homes, as well as their designated caregivers for those residents. Those who received a complete series of a viral vector vaccine, i.e. 2 doses of the AstraZeneca vaccine or 1 dose of the Janssen vaccine, and First Nations, Inuit, and Métis adults and their non-Indigenous household members. If you are an eligible healthcare worker in a Peel hospital, please contact your hospital's Occupational Health and Safety Department to learn of your hospital's plans to offer boosters. For all other groups, you will be able to book on the provincial booking system if 6 months have passed since your last dose. Booking for expanded third doses will commence on the provincial system on Saturday morning at 8 a.m. And you can visit peelregion.ca/COVID-19 vaccine for further information or for a link to that website. Please note that while we continue to reserve walk-in capacity for first and second doses, third doses must be booked online and in accordance with the province's specified interval of 6 months since your last dose. Also, while noting that our province has announced plans to expand third dose eligibility to all age groups through 2022, at Peel Public Health, our priority continues at this time to be getting first and second doses to those who do not have any protection at all, especially our 5 to 11 population once they come eligible. The first 2 doses of vaccine in the manner in which they have been delivered in Canada provide robust immunity for most groups, which is waning gradually, not quickly, even for those who have been identified for boosters. As we ramp up our vaccine system across Peel, we will also continue to identify how and where we can reach the last pockets of our community with vaccines to try to close in on the 90% 2-dose coverage that will make this virus less novel for our population. Finally, I want to speak directly to those who have not yet received their 2 doses of vaccine. You continue to remain at risk of severe and mortal outcomes from COVID-19. The vaccines are safe and effective, and together with continued precautions such as masking and self-isolating when sick, the vaccines represent our best promise for emerging from this pandemic sooner rather than later. If you have questions or concerns, please speak to your family, your friends, your primary care provider, learn about their information and their vaccine journey. Our staff are also available to answer questions you may have and make your experience as comfortable as possible. Please visit peelregion.ca/COVID-19 vaccine to get answers to your questions and also find a clinic where you can get your vaccine. If you get vaccinated today, you will be able to protect yourself completely with a full series just before the end of your holiday season. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe. And now, along with Dr. Lowe, Nancy McDonald-Duncan and Sam Rogers, we are happy to take questions from the media.
Your first question today comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Good morning, Mayor Crombie. How are you?
Good morning, Steve. I'm very well. How about you?
I'm okay. I wanted to ask again about the city's vaccination program for its employees. My understanding from speaking with My Way union reps is that the vaccination disclosure rate of transit staff is around 71%, which is up 50% from last month. It also seems like due to challenges with getting some Mississauga staff to disclose their status, the deadline to disclose has been changed a few times.
That's right.
Since it was initially announced. Is it time for the city to implement stronger disciplinary actions for employees that are either refusing to disclose their vaccination status or refusing to get fully vaccinated?
Right. So, Steve, as you know, we did, and you've got the inside scoop, do you? Look at you. We did extend the deadline, and so now the deadline closes this Friday, and the numbers are looking very promising, so we're very pleased. But let's not forget, this is the employees in which we had not disclosed to us are largely shift workers or part-time workers that it was cumbersome for them to report in and disclose. So that's why we continue to extend the deadline. But by this Friday, we should have better information. The numbers among the part-time staff are extremely high, and we're very confident. I think you're on target for the My Way staff. However, there were still more people yet to disclose, so I'm very confident that number will increase. So the policy as we stand is disclosure. Anyone who refuses to disclose or isn't vaccinated must go through a mandatory education session. We're very hopeful that through that education session, more will become vaccinated. If not, then mandatory negative test to come to work was in effect as of November 1st. Whether or not there have been employees sent home, I think there were a couple, but they went out and got the test and came in. And so we're very confident the numbers continue to grow. And at this point, that is our policy. If they refuse to attend the education sessions or refuse to disclose, just like in other municipalities, there are other disciplinary measures, which include sending them home on suspended leave without pay.
I'm just curious why there seems to be kind of a hesitation around discipline beyond the kind of the education session or the testing you're talking about. I'm just referencing here Toronto earlier announced that employees could be dismissed or fired altogether, and just by the end of the year if they don't disclose or aren't fully vaccinated. So why is this? And they're currently at around 94% of employees fully vaccinated, 99% have disclosed. So why is there hesitancy to implement stronger discipline?
Yeah, so I'm very confident we don't have to use that heavy hammer, that our employees will disclose, will be vaccinated, and the numbers are growing each and every day. So I'm very, very hopeful we won't have to impose those kinds of measures here at the City of Mississauga, but, we'll reevaluate when the time comes.
Your next question comes from Declan Finnegan from Mississauga. Go ahead, Declan.
Good morning, Declan.
Good morning, Bonnie. How are you?
I'm so very well. Hope you're well, too.
Thank you very much. Is there any indication that areas in South Mississauga you've identified in recent weeks as having lower vaccination numbers are now increasing their vaccination numbers?
Yes, things are steadily improving. I think I'll invite Dr. Lowe, because since he's the keeper of all data, and as a combination of data that we've received from Trillium Health Partners and Peel Public Health. Initially, the data came from Trillium Health Partners as they were tracking the postal codes of individuals which were hospitalized or in the ICU. And of course, Dr. Lowe has the data right across the City of Mississauga amongst all the neighborhoods. So those numbers are steadily increasing, so I'm very hopeful. We have achieved across the city 84%, which is the number across the province as well of fully vaccinated, and the numbers continue to grow. Dr. Lowe, do you have any more information about those problem neighborhoods? Thank you.
Thank you very much, Mayor Crombie, and thanks, Declan, for the question. Our mobile vaccination and our overall community vaccination team continues their outreach in these neighborhoods. It is worth noting that we continue to make steady progress, usually about 1,000 first doses a day. It is slower work because you are really trying to work with individuals, trying to understand where they may have concerns, where they may have misunderstandings, where they may have certain biases or challenges that need to be addressed. But our community vaccination team, as well as our community agency partners, are committed to this work. And thanks to that, we've actually now gotten just within striking distance of 90% 2 doses. 100,000-ish doses remain, about 106,000 doses, of which 20,000 are first doses and 80,000 are second doses. So we really have an opportunity here and continue to work in neighborhoods within South Central and East Mississauga that have areas of lower uptake to really ensure we can bring this protection to our community. Thanks so much for the question.
Thank you. And if I may have another question for Mayor Crombie.
Yes, you may. I'm right here.
You mentioned last week you're concerned the Ontario government might loosen restrictions too soon come January and then again in March. How much faith do you have that the Premier will delay lifting of restrictions should some concerning COVID trends develop in the coming months?
So I know the Premier will always do the right thing, and so I'm very hopeful that he is monitoring the same trends I am. I had the opportunity to speak with him personally on Friday, and I let him know that there were certain concerning neighborhoods and trends in our hospitals, and that's why I was a little bit concerned. But certainly I hope that if the conditions don't merit a further reopening, then we wouldn't proceed. But if they do, then we should. And Dr. Lowe would also like to address this question. He's flagging at me, waving at me. So, we are all monitoring the situation and all the indices at all time, whether they're case counts, hospitalization rates, etc. So I think we are in a good position today. I was nervous and very cautious last week as I saw the hospitalization rates grow and saw that certain neighborhoods weren't at the city average or the provincial average, and I let him know those were the reasons for my concern. But if he sees those trends province-wide, I know he'll act, but he also has to balance the situation right across the province. My concern is Mississauga, but he has communities where they have very low COVID rates or none at all, whereas here, we still have hospitalizations. So I would at that time, should the conditions prevail, request that he take a more cautious approach for our city and our region, if the conditions merit, right? But things are slowly improving, so I'm very, very hopeful that won't be the case. And Dr. Lowe would like to respond to this as well.
Yes, thank you, Madam Mayor. And, I wanted to respond to this question because it's actually very important to drive the point home that ensuring that we don't go backwards is ultimately in all of our hands. And so, for people who haven't yet been vaccinated, we know that the vast majority of people that are showing up in hospital, that are experiencing severe and mortal outcomes from COVID-19 are individuals who are under-vaccinated or unvaccinated without 2 doses of vaccine on board. Vaccines are the surest way. Ensuring that we're continuing to mask in indoor public spaces and in crowds, that will continue. And if you think about it, back in last fall, we had to close the community because we were all susceptible, we were all unvaccinated, the novel virus was spreading quickly. And now, because we have such high vaccination, it really comes down to just 3 simple things that we can all do. Wear a mask when you're indoors as much as possible, if it's possible, and ensure that you're complying with certificate policies in settings where it's not possible to maintain masking all the time. Ensure that you get vaccinated. And the real big principle, which frankly is something that should outlast the pandemic, is if you are sick, please do not leave. Please do not meet people. Don't leave your home. Just make sure that you get tested and self-isolate. Make sure you're not spreading whatever it is, whether it's COVID or flu or any other respiratory disease you have. Ultimately, keeping our community open is in all of our hands, so I encourage everyone to continue getting vaccinated, masking, and staying home and getting tested if you're sick. Thanks so much, and I'll pass it back to Mayor.
Thank you to my wingman over here, Dr. Lowe. Next question, please.
Your next question comes from Pooja Luthra at Y Media. Go ahead, Pooja.
Welcome, Pooja.
Yeah, hi. Hello, Mayor. Happy Diwali.
Happy Diwali, Shubh Diwali to you too, and Bandi Chor Divas.
Yeah, thank you. I would like to know that, Ontario has denied COVID-19 vaccine mandates for health workers, despite getting advice from Science Table. So what does you or Dr. Lowe has to say on this?
So I'll just open it up a little bit. And, I do have some concerns about this. And I know the Premier is very concerned about the staffing levels at the hospitals with respect to healthcare professionals, nurses and doctors, etc. I personally would have preferred that vaccine mandate amongst all healthcare workers. It's just my opinion. I know that the Premier has other concerns, and that is the shortage of staff and the expertise in the hospitals. However, I also know, I'm aware that hospitals have taken on the responsibility themselves and are requiring their own staff to be fully vaccinated. So they have taken on that responsibility, and I really think that that was the right direction to go to ensure that anyone, frontline healthcare workers, are all vaccinated. Dr. Lowe, would you like to? Let's ask him to respond as well.
Thank you.
Yeah, thank you, Mayor Crombie, and thank you, Pooja, for the question. It's certainly unfortunate, I think, and I think I'm heartened, though, that many hospitals are actually continuing forward in implementing these mask mandates. I know that staffing shortages are a challenge, and I know that our hospital CEO partners are working, and their leadership teams are working diligently to clear the backlogs. But we also know that outbreaks in hospitals disrupt healthcare services significantly. We also know that many people in hospitals may be people who are immunosuppressed or have other vulnerabilities, so it's a patient safety issue if people are potentially transmitting COVID-19. So it's a patient safety issue. Outbreaks can cause staffing shortages. So it really is a challenge. And a good friend of mine, Dr. Matthew Otten, who's in Montreal, actually came up with an analogy that when speaking with him recently, where he said, if you join the army, you expect that you may be caught in the line of fire, you may be caught having to in battle. If you work in a hospital, you might expect that you need to protect yourself against an infectious disease. I mean, the reality is that you may come in contact with an infectious disease in the hospital, and then, if you're unvaccinated, potentially spread it to an individual who is unable to mount a strong immune response or create an outbreak that essentially shuts down part of the hospital. So, I mean, it's basically pay now or pay later in respect of these challenges. So, I think the Council of Medical Officers of Health and I were, I with them, we were, I think unequivocal in our support for, vaccination mandates, really to ultimately protect patients and also protect the healthcare workers that serve them. Thanks so much for the question.
Thank you so much. My follow-up with Mayor Crombie.
Yes, I'm here.
Yeah, I would like to know that today Ontario is releasing economic outlook and fiscal review. So, what can we expect in that? Thank you.
Oh, so yes, we're very hopeful. I know all the municipalities, cities have made requests of the province, and particularly Finance Minister Bethlen Falvey. We all continue to need safe restart funding for our operational deficits. Those cities and communities that operate large transit systems continue to face challenges with respect to passenger and rider levels. Our ridership continues to be under 50%, so we continue to face deficits in those areas, so we're continuing to hope for support to come out of this challenge, because as you know, cities can't run deficits. And then there are some other specific asks we've all made. In particular, Mississauga is looking for a regulatory change to the payment in lieu of taxes that the airport makes, and there are a number of other measures that are specific to each municipality, but we're very hopeful that this will be a strong statement, a strong economic recovery statement, with plans from the provincial government on moving forward out of the recovery, and continued funding for municipalities and for public health, I should add. A lot of the costs that we incurred were to set up the vaccination clinics, hire additional staff, and we'd need to be reimbursed for public health care costs. So, Mississauga is no different than many of the other larger municipalities, incurred significant costs, and we're hopeful that the provincial government will rebate those. Thank you.
Your next question comes from Natasha O'Neill at The Pointer. Go ahead, Natasha.
Welcome, Natasha. Thank you for joining us for the Bombardier announcement, by the way.
Oh, thank you. It was very fun. I have a question about the planning committee meeting on Monday. Lakeview's official plan will be either denied or approved, and I'm kind of wondering what your thoughts on it and if you will be approving it.
So my thought is it is a marvelous mixed-use community, a once-in-a-lifetime opportunity to build such a sustainable, livable community on the waterfront. I think the eyes of the world are on us. I want to do this right. I want to do it very carefully, and I'm very excited about the prospect. So it's a very ambitious project. I want to thank the Lakeview partners for their continued investment, and they're investing in the community all around, and I really think they want to do the right thing, and I'm very excited about some of the cutting-edge features like the district energy and the vacuum waste and other cutting-edge technology that will be employed, and that we're building a mixed-use, livable, walkable, sustainable community on the water on reclaimed land. Let's not forget that that was a power plant, and now we're repurposing it to a place where people can live, a place where people can work, where there'll be recreation and access to the water. There's so much potential for this site. So I'm very hopeful it will be approved, and I know the group is trying to do the right thing as well.
Fantastic. I just have another question for Dr. Lowe.
Certainly, I'll invite him up to the podium.
So we're talking a lot about booster shots for specific individuals. I'm just wondering if there is a point in time where you think everyone in Peel will need a booster shot, and what happens if a large majority of people do not go and get their third one? Will we see cases spike and rise very rapidly like we have in the past?
Yeah, thanks so much for the question, Natasha. To be very clear, 2 doses of vaccine protect you significantly against severe and mortal outcomes. So it is very clear that with 2 doses of vaccine, the virus is no longer novel. And even if the active immunity, which prevents or reduces the chance of infection, starts to wane and wear off, the risk of the severe outcomes that really drove many of the previous measures is gone. And that's one of the big reasons, is largely gone. And that's one of the big reasons why we're really encouraging as many people as possible to get just those first 2 doses of vaccine to ensure that we are reducing the novelty of this virus. Because really, once the vast majority of our community has been exposed to this virus, either through infection or through vaccination, this is no longer a novel coronavirus. That said, we do know that, especially for certain groups, immune responses and the active immune response can tend to wane over time. It tends to wane more in individuals who already have challenges with their immune system. It also tends to wane in people who are older, just because, in general, as you age, your immune system doesn't necessarily generate the same robust responses to disease pathogens as they previously did. So that's why those groups have been slated for expanded eligibility at this point in time, and also individuals who are, working with those groups. I think that's basically what you've seen out of the provincial announcement. Obviously, many serologic studies are continuing. We're trying to figure out what correlates to immunity and how long and how strong the immunity lasts. And so far, every indication is that 2 doses provides a powerful and persistent protection, even up to this point, as they were delivered in Canada at the delayed interval, which actually turned out to be the optimal interval. So I think, Dr. Kieran Moore and the province indicated that they're continuing to monitor the data, and where it may be necessary, they will make recommendations for additional tranches of ages to be opened up. We'll continue to work with our provincial partners, but I think at this time, our priority really continues to be getting first and second doses to as many people as possible to eliminate the risk of severe mortal outcomes, and also preparing for first and second doses for 5 to 11, so that we can eliminate that last large, active, and high contact reservoir in our community and finally move past this pandemic. Thanks so much for the question.
Next question, please.
That was your last question for the day.
Thanks very much for joining us today.